Okay, hi everyone. So my name is Dr. Thomas Dale MacLaine, and I'm going to do a session on how to write a scientific abstract. And I've got to say, I love writing abstracts, which sounds a bit silly, but I think they have so much value, and I want to kind of share my affection for them, and hopefully some of the skills and tips that I picked up along the way that helped you write your abstracts when it comes to your projects. So the things that we're going to cover in this talk, what is an abstract and why they're important? What does an abstract look like? What makes a good and a bad abstract? How do you plan for an abstract when you have data? And how do you do so when you don't have data? And then a couple of tips that I've collected from elsewhere. Now, I will say this is an interactive workshop, so my hope is that you can all see the chat function and type out. And as we go along, I will read out what people are typing so that those looking back at the recording can then understand what we're discussing. So if we move forwards to what is an abstract and why they're important, let's start off with the first one. Does anyone know what an abstract is, or how would you define an abstract in scientific literature? So I'll give you a couple of minutes to write down some of your ideas on the chat function. And feel free to be loose with your definition. You don't have to be Collins Dictionary level. So I already love the first one, which is a scientific too long didn't read, which if I gave you my thesis, it's around 250,000 words, 2 volumes. It gave me repetitive strain injury in both arms, and the too long didn't read, I think, was very well received. So an executive summary of the research or an overview, absolutely. And that's really important, that it is an overview of what's happening and not a specific description. A small blurb letting the conference, human or otherwise, know that they are going to miss if they don't pick you. So I wouldn't just say conference human, because you would do abstracts for publications as well. It's the way that I kind of describe it is it's like an elevator pitch. So you've only got a short amount of time for someone's short amount of interest, and you really want to hit home the core messages. Why are they important? So again, a few comments on why do you think abstracts are important. If you don't want to use the chat function, you can also say it out, but remember, you will be being recorded as you speak. So one reason that they're important is to prevent students having to read the entire paper, which is fair enough for certain points, and I'll explain a little bit more on those a little bit later on. And it's not just students. I mean, you've got the public that look at them, you have other scientists that are in your area, you've got examiners that look at them. So we've got help screen relevant papers, and that's really important, actually. So if you're doing a systematic review, you start looking at the title and abstract to work out whether that publication is relevant for your literature search. So you get an idea of the whole picture before reading the paper. Absolutely. So for the clinicians among us, we have this horrible, horrible thing where we have to assess an individual from what we call an end of the bed test. And the end of the bed test is we stand and look at them and we use our prejudices based on what we're seeing to inform us of what their healthcare and engagement with healthcare might be. Do they have their inhalers with them, or are they on an IV drip, or are they looking disheveled, and do they look like they don't look after their clothing, what have you? Those are kind of things that we do as clinicians to get a better understanding of the patient before we've even spoken to them. And an abstract, in a way, helps us identify the quality and content of the paper or the talk that we're going to engage with that the abstract represents. So there's a lot in there. So what's an abstract? As we say, it's giving insight into your work that's going to come ahead. And it's a short overview about what the work actually is and why we as scientists or clinicians or the public should actually care about it. And in your abstracts, be unapologetic And that's one of the main tips that I can give straight away. You have done this fantastic piece of work and you're trying to hit home the key messages. Be unreserved in how you're explaining them within such a tight frame of word count. This one sounds incredibly obvious. Tell people you're trying to tell them, tell people what you're trying to tell them in your abstract. And what I mean by that is get your key messages of your publication or of your conference talk and really hammer home that key message in your abstract so people understand what it is you're trying to say. Welcome to the chat and welcome to the talk for those who have just arrived. Just to let you know, the call is recorded. Feel free to speak on audio if you'd like, but we do have the chat function which we're using throughout. So this is what, if you want to start looking at abstracts and trying to publish an abstract, this is where you'd go to first. You'd go to the journal that you're trying to submit to. So if you are presenting at the AME conference, the Academic Medical Education Conference, you'd then be looking to the medical teacher guidelines to see what their abstracts are. And I've got a couple of extracts. So BMJ Open, for example, says that they should be structured, and they should be structured in a way that has an introduction, methods, analysis, ethics and dissemination section, and then you should have your registration details included separately. The Journal of Frailty and Sarcopenia, or Frailty and Aging, it goes by both names. They've explained that it has 300 words if it's an original paper and has a structured of background, objective, design, setting, participants, intervention, measurements, results and conclusions. Now that's, you know, half of the word count in just writing those titles, so it's quite strict. And you can see, again, if you look at the Annals of Surgery, working our way up what's called an impact factor. And we can talk about those at a later session. But Annals of Surgery, for example, have two different sections. One is a mini abstract, and that tends to be something called unstructured, where it's 50 words or 3 sentences that define what you're going to be talking about in your publication. And a structured abstract, which is, 250 words. You've got your set structure so far. And as you can see, it's variable depending on where you go. So when you come to think about submitting an abstract for a conference or for your publication, the first thing is to identify what the criteria are that you have to meet. Because if you submit something that's 300 words to 250 word restriction, they're going to reject it and send it back to you. And they can be a bit cutthroat based on that. So some people have been rejected based on just a simple edit of 50 words. So we've talked about why they're important. I've got this paper about why titles and abstracts are so important, and I can share that out with, you can get the access to these slides or give me an email and I'll send it to you. But in here, this explains exactly why titles and abstracts are so pivotal in education or in literature. So often abstracts and titles are the only thing that's available without institutional or paid access to the journals. And that's one of the reasons why they are used so widely as the first part of triaging or first part of assessing in systematic reviews. And people use those as inclusion or exclusion criteria so that they can understand what literature is out there relevant to their section. And you want your work included in a systematic review because that provides you with extra citations, it gets your work out there further to a bigger readership, and it helps evaluate the work that you've done and help your work become more included in more effective change later on. The abstracts also need to be a sales pitch, as I say, an elevator pitch. It needs to draw the reader from simply passively perusing this set of prose or your abstract to actually engage with the work, either to attend your conference or to look at the recording or to delve into the actual publication and read it properly. And as I mentioned, abstracts are representative of the quality of the work that they represent. So you need to make sure when you're writing an abstract that they are of a high quality so that those who are reading it can perceive your work to be of a high quality. So what does an abstract look like? Well, I've shown you that there's a few structures to them, and I'll remind you of what this is. You've had the BMJ Open, where they have a sort of structure, and then in the Journal of Frailty and Aging, you've got an even more intensive structure, or you can have a mini abstract. And there's a few different ones, so you need to be careful about which form of abstract you're submitting for what it is that you're doing. And it'll say that on the guidance for authors or instructions for authors of where you're going for. Now, with abstracts, they can be divided into two different thoughts. One is structured versus unstructured, and the second is descriptive versus informative. Now, as you've seen, you've had structured previously on the last slide, where it typically follows introduction or background, methods, results, and conclusions. You often don't have things such as discussion in there because that's the juicy, sexy bit that you want to get into the paper. So that helps draw the reader in. You can have unstructured ones as well, where they are more free-flowing and they're not often used in original research, but maybe in other forms, such as letter to the editor. They often don't have headings. However, most people tend to write them in a similar format. In terms of descriptive versus informative, well, descriptive, it says it on the top. It's very much a description of what it is that you are going to be saying in your publication or in your presentation. And that often provides people with an interest that may want to come and read it or come and view what you're doing. Informative, this is a lot more useful when it comes to scientific abstracts that are published in literature, especially those in areas that need a systematic review, because you're providing key results in your abstract that people can then reflect on, and if they're interested or relevant, can go further into that. And as I've mentioned, structured and informative abstracts tend to be more common in scientific abstracts. Though if we look at sociological or psychological backgrounds, they tend to be either more descriptive or unstructured. Now, in the chat function, what I'd like for you to do is have a little guess, or see if you can work out rather, is this structured or unstructured? And is this descriptive or informative? So write down in the chat which ones you think they are. So we have one person considering this might be a structured one. Someone saying structured and informative. Yeah. So we can see that it's structured because we have very much an introduction, methods, results, discussion, and conclusion. And because we have those headlines, that identifies this as a structured abstract. And people are saying that it's informative, very much so in terms of the results section. So if you look, there has been a survey that's been provided. 2 out of 120 individuals identified previous experience with virtual patients. Of the 142, XYZ. So you can see that the data is very much present in the results section. And this is one of the abstracts that's come out from having the results already, or the data already, as opposed to presenting an abstract without data. So we've got another one for you. What do you think of this? I'm sorry this is pushed to the side of the screen. However, have a little think. This is an abstract that has been submitted. Is this structured or unstructured? Is this descriptive or informative? And feel free to write those down in the chat again. And if you've got any questions, either speak up or write them into the chat and I'll happily answer them. So is this structured or unstructured? So we've got one comment saying it potentially is unstructured and descriptive. This one's a little harder. and I'll explain why in a second. So we've got one comment saying unstructured and informative. And another unstructured and informative. Absolutely. So this is unstructured and informative. So unstructured abstracts, as we say, don't have any of the headlines. So as you can see, there's no headlines or subtitles on here saying where is the difference between the methods and the discussion, or methods and results. But what you can see within the actual content is that staff and patients, given their values, were positive about quality of calls, and their results are 9.0 with an interquartile range of 8 to 10. So it's providing actual valuable data within the content of the abstract, which could then be used or extrapolated. So it's an unstructured and informative. And the reason it's harder is because we are either familiar with structured abstracts, or our eyes are easier to determine what content is within which section of an abstract when it's structured. If it's unstructured, it's hard to piece out whether the data there is enough to say whether it's informative or descriptive. And here we talk about the actual data as opposed to the description of the contents of the paper. So you can see that this is referring to its informative nature. Fantastic. So, getting you to do a little bit more work, what do you think makes a good abstract? Because there's a lot that could go into an abstract. What would you want to see from an abstract that would be valuable? So feel free to write something down, and we'll carry on to the bad abstracts shortly. So a good abstract, what they did, statistical findings, conclusion or two. It has to be clear and on point. Absolutely. Especially if you've got a word count of 150, 250. It's hard to make a waffle sit well in an abstract of that length. So it needs to be succinct. The methods, findings, and conclusions need to be present. It needs to demonstrate what questions were asked or were being asked by the study. Fantastic. So someone's mentioned not using acronyms unless they are incredibly well known. And I would actually argue that no abbreviation should be in an abstract without definition. I'm going to use an example of ED. So I work in an emergency department with patients who have eating disorders. ED could be used for both, and it could become very confusing. So always make sure that your abbreviations come from an expanded text. So previously, a couple of authors have used acronyms that you're not sure about because the authors thought they were obvious, and it's hard to find them until you look at the paper. And to be honest, I find that a bit almost deceitful that you have to look at the paper to see if you can identify what that actually means, because it wastes your time. And I find that part of the quality side, where you think this abstract, does it have quality? And if so, does the paper have quality? And what makes a bad abstract? So we've got the negatives of everything. So it's got to be waffly, it's got to be loosely associated with the research or not at all. It might be missing its conclusions. It might show its statistical findings, and they might be ill-explained. You can have good abstracts without statistical findings. For example, if it's a qualitative paper, you might still have findings that aren't statistical. Or you might be doing a presentation or an abstract on something without data. And in that case, then you're trying to showcase something else as opposed to the results. So we'll move forwards. And I want you to come back to this example of the abstract. And I want you to say whether you like it or don't like it, or what is it that you like within it and what is it you don't like within it. And I'm sorry for the pixelation. That's my fault from screenshotting. So I'll give you a moment to have a little look through this, and I want hopefully some feedback about this, what you like and what you don't like. So some of the people, some of the comments coming through, it's well structured, easy to read. The acronym LVP was explained before it was used. The subheadings makes it easier to digest, and that's why scientists prefer a structured abstract as opposed to an unstructured abstract. So the bite-sized headings are liked. Dislike the old cliched conclusion of further work to be undertaken. Absolutely, and that's often a cop-out or often used to get people to think about what future work the paper is going to be talking about. So sometimes your conclusion could be saying this needs a significant amount of work, and that could be true. Or you might have the data inside that says we have found unequivocal evidence that X means Y. And it depends on what you're after within your paper. So from here, the conclusion kind of suggests that the evidence that they've collected isn't representative of what could be effective change to make everyone change their practice, but that this group might be working towards future works in the future. So liking subheadings and intro, don't think the discussion is adding much. Absolutely, so it's almost repetition. So LVPs are agreeable to medical students. Well, we've seen that in the results. There's good engagement and positive reports of clinical learning. Again, sort of replicating what's in the results. Every sentence has a clear and defined purpose. A tiny bit about what scales used to collect the data, especially to see if they were appropriate or validated. Now that's interesting because the validation of a tool is so valuable, and if you were using unvalidated tools, it can throw everything into disrepute. Now, for this group, you wonder whether or not they were using tools that were validated or not. Does that draw you into the actual paper? Method section's not detailed enough, so I would agree. I'd say that it's quite difficult to make sure that your method section is detailed. So if you're thinking again, is the method section or the discussion or the conclusion not enough to keep your appetite whetted, are you then going to look more into this? So if you were a person who was providing longitudinal patients or providing virtual patients, is this enough that would make you then go to read this publication? So we're going to move on to the next one, unless anyone has any further questions. Okay, so I'm going to move on. So we have another abstract here. Now this one, you can see it's an unstructured abstract, and it looks like it's fairly descriptive. Have a little read, tell me what you like and don't like. Too much text and a little off-putting, and I think actually this has a very similar word count to other abstracts that I think you'll have seen in the past, and a lot of that is a distinguish between an unstructured and a structured abstract. So unstructured abstracts look like a wall of text, and they're very hard to really understand the content. Took a long time to get to the point at first. Just give us the details we need. Fully agree. So there is a lot of detail at the start before really understanding the content of the work. This is a descriptive abstract and needs to describe what's in the paper, and you don't get to that until maybe the fourth sentence. Rob, I'm going to come to your pet hate of not justifying the paragraph in a second. So someone said that they know it's an abstract, so not appropriate to add citations. I agree, but it's felt like there's a lot of citation needed moments. And that's really interesting because in an abstract, you don't provide your citations. But what your abstract should be is a standalone bucket of text that clearly narrates what it is you're trying to show, the key points or description of the publication or of the conference talk. Now, if you aren't able to do that without backing up your work with citations, it's not a well-written abstract. You don't find out what they did until the last sentence. That definitely should come earlier. That definitely should have come earlier. Your methods you expect halfway through. Even in an unstructured abstract, you tend to have those a little earlier on so you understand what they've done to get to why they're explaining it. Keyword section at the bottom, that's a positive. It's great you're finding positives. It's really useful to have keywords, and often your journals will request keywords within your abstract or at the bottom of your abstract. And they are really useful when it comes to literature searches. So there are terms called MESH terms, MESH, which you can use to specifically look for certain literature. And that's the way to go through. Again, someone's commented, doesn't say what they did or doesn't clearly state what they've actually done. So I'm just going to come back to the justification of the text. So to justify the text, it means that it has equal left to right spacing in terms of the column that it fits within, but sometimes the spaces between the text can be variable. Now, an important point of justification of text is that justified text is less accessible than those with left, center, or right alignment. And that's for those who have some neurodiversity, where it's impenetrable if those texts are fully justified across the screen. So my recommendations are always to avoid using justified texts for the accessibility of others. It does make for a nicer looking bit of prose. However, it's often a barrier for people accessing your abstract. So in a poster, it might be more appealing because you're using your visual appeal to draw the person in, but on a written abstract for a publication such as this one was, which you couldn't have known before, this is left aligned for its accessibility. But that's fantastic. Everyone's given so many thoughts. I've got two more for you. So we've seen this one previously. This is the unstructured informative abstract. Let me have it. Let me see what you've got. Okay, so comments are coming in now. So introduction could have been cut down, clearer as to what they did. It's a good summary of the findings. Someone's liked that the comment or the use of the words has been, it is likely that, as opposed to the last one or last abstract where they were certain, hence where the citations were needed. It makes it seem more balanced and wanting to read on. And I think what's important is that in your abstract, it needs to be a sales pitch, but it cannot say what the data is doing when the data doesn't do it. So you need to be very confident in what you're saying, but up to the point where your data allows. If you had data that said red wine is nice, you couldn't then say in your abstract, data says that red wine is the ultimate, because you've only got up to nice. But you could say that the data indicate that red wine is likely to be preferred. So those are quite useful nuances to be aware of. Sentences are concise, there's a clear structure. Don't know how useful the stats are at this point. Absolutely. So medians and interquartile ranges don't give you a lot of context as to what their relevance is. And that's quite a niche thing to pick up on specifically. However, what you're looking at is the spread of the interquartile range in relation to the staff or the total volume of recipients from the surveys. And I think at that point you wonder whether there's any more data within the actual work, whether it's a conference or a publication. Is there any more data that you want to be looking at? Or if this is the total amount of data that they've got, is it worth it? But it is good that they've used numbers. It is good that they've identified quantitative rationale for some of their work as well. Good. You're being fantastic at this. You've not seen this one before, but this is the last one. Here we've got an informative, structured abstract. So overall positive. There's a lack of consensus over frailty definition. They've opened it, but then it feels like there's nothing else left. So introduction, let's define frailty. Then there's a continue with no definition of frailty. So it's good that you're picking up that at the start there is no consensus, and that's what this work tries to identify. At the end, in your conclusion, it feels like they haven't identified the actual definition, and whilst they might have some interesting results in the results section, they haven't necessarily answered the question that they proposed. Absolutely. Again, I'm sure we'll all like that the fact that there's data there. They've explained what the pooled odds ratio OR means and the confidence intervals CI means. They explain a little bit. There's something for me where I would ask whether people understand what random effects meta-analysis modelling is. And if you don't know, would that stop you understanding the rest of the data, or would it make you want to go and look at it more? And I'll leave that question rhetorical. But this is one of the ones that I actually did like, because my background's in this area of research. And this systematic review was actually quite useful for changing quite a lot of practice. However, I fully agree that at the end of this publication, if you read it, you still don't have an answer as to whether or not there's a definition of frailty. So I think that's a really key point to pick up on. So let's go through some of the good and the bad that we've seen. So positives, when it's concise, when it's structured, when there's a flow. If you've asked a question in your introduction, you want to then finish the loop or close the loop by answering the question in your conclusion. We want more information in our method sections, but we want to make sure the method sections leads you on into the publication. Sometimes if you are providing content within your abstract, it needs to make sure that it stands alone as opposed to needing to go to the article for more information. And that's a key point, whether you need to cite some of the content that you're writing. And if you feel like you do, then make sure that you reword that so it stands alone quite nicely. Make sure every sentence you write has a point. And that's a really good tip. So if you're writing an abstract and you're waffling and a sentence you're saying or writing doesn't have a different point to the others around it, remove it. And that's a really important part of editing and refining your abstract. Bad, what I'm seeing is that we don't like unstructured as much as we like structured. And if we do an unstructured one, you still tend to follow a structured example and then remove the headings. Otherwise, the format doesn't necessarily flow as you would like it to. And what you're really trying to do is make sure that you're telling the story early to capture the reader's interest. You don't want 4 sentences down the line for you to make your first point. So that's fantastic. Is there any questions or anything anyone has on the abstracts that we've seen so far? So we don't have any questions, so I'll move on. So this is how I personally approach abstracts when I have data. And I'll make sure the slides are available so that you can reflect on these and either use this process or do one of your own. And this is a block of text, and that's why I say we'll go through it, but you'll also have this to reflect on. So the first thing I always do is check the abstract guidelines on submission, and that's why I started to talk with examples of different journals and how you submit your abstracts to them. And I would do it in a separate Word document. I take the instructions and I copy and paste them into a comment on the Word document and make sure that I've got the information I need, such as what's the word count, is it structured or unstructured? If this is one where I don't know whether it needs to be descriptive or informative, my assumption is it's informative, but have a little look at a different abstract published by the same group or same journal and see whether they have informative or descriptive, now that you can tell the difference between the two. When you have that, move on, and when you're in a position to start submitting the work, after you've got all of your data and after you've started writing or finished writing your actual work or conference talk, I tend to verbalize my key points out loud. So I've made an example of this below. So if you know X and thought Y, yada, 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 and I'll leave that for you to read, but I'll give an example. So if I know that if I provide a teaching experience, it should help engage students, and in the end, they should be better in that area or in that skill. So if I'm testing a group of students on a skill, I want to know whether or not they're going to be better. That's how I would start approaching it. So if sorry, this is a bit verbose. If I've done a piece of work and I know that the longitudinal virtual patient improves students in their ability to do clinical reasoning, I could say that out loud and say we have had 120 responses where 2 students have had previous exposure to the virtual patients in a different setting, and up to 95% were completed in a certain time. These are the key points that I'd be writing down, and that was from the abstract earlier. So even though we've only looked at it shortly, that data is very present. After I've written those down, I then start putting those into the abstract guidelines that's on that Word document. And when you've done that and you've started to flesh out your abstract properly, check it. Have a day off, come back to it fresh. Have you put in any abbreviations? Have you put any references to figures? So if you've taken a copy and paste from your work, you might have referred to a figure or a table. You can't do that because this is a standalone piece. So you need to make sure you've edited that out. Do you have references in there? Remove those. Is the data correct? If I've said in my paper 95% had achieved 100% of the activity, and then I'm saying that 92 have, then people are going to look at that a bit strangely and work out why there's a difference. Is there a spelling or grammatical error? So there was a capital B for both in the middle of a sentence. That shouldn't have been there. Make sure you're going through and removing these issues. Make sure you're in the word count. That's one of the last things I would do before I then share that out with supervisors or colleagues. If I can't get it down in terms of the word count, I would make sure that I reshare that and specify we are 55 words over the word count. I need help cutting it. And that's where they will guide you. I appreciate that's quite verbose. Does anyone have any questions on that process? Nothing's coming through. So just to reiterate, get your guidelines first. When you're ready to start submitting the work, say it out loud what you're trying to tell in your abstract and write those points down. When you've written those down, start drafting those into your abstract. And when you've finished your abstract, start checking for any of the specific errors that you can, such as abbreviations and what have you. Cut down so that you're in the word count, make it concise, and then finally share it with your supervisor or colleagues for review. If there's no data and you're presenting at a conference, there's no real change to that process. It's just the content of the abstract changes. So keep in mind a few of these tips. Make sure if you're presenting something that there's a point to what you're presenting. If you are presenting on the use of social media to collect students' opinions, then what you're doing is you're using social media and you don't have any data. So make it clear the work that you're doing is showcasing the use of social media to collect that data and the pitfalls and the positives around it. So make sure that's what your abstracts turn to, and that would hopefully satiate some people's requirement for having more in the methods. And more people will attend because you are showcasing your methods and they want to hear a bit more about it. Do not ever fabricate results. And I only say this out of experience of seeing others do it. I don't believe that anyone would, but then I've seen it done. If you fabricate results, people will identify the problem fairly early on, and you will be discredited, and those around you or that work with you will be discredited. Make sure that you don't think to input results temporarily and publish those and change them in the session or in your publication, because that will put you into a lot of disrepute. If you're doing, as I say, without data abstracts, hit the introduction, methods, and conclusion harder. If it's a work in progress, state what you're testing and change the focus to the methodology. So as I've mentioned, you're looking at either social networking's use, or if you're testing a drug, maybe you're doing something different about the way you're testing that drug. Or is it the fact that the drug will make a substantial difference to the cost benefit or of the epidemiological presence of a condition? There's a lot you could do. So have a little think about how you reframe your structure to give more word count to the methodology. But don't let it put you off. There are a lot of fantastic talks at conferences, especially around the use of methodology in their work when they don't have any data. And it's very interesting because people are then stating, this is the work that we have already designed and we are already doing. We are collecting data at the moment, or we're about to. This is our area of expertise. And you'll find that people want to then collaborate with you as a result of you sharing that information with them. And they're ideal for conferences, as I say, for early career researchers as well, because these are when you don't have data but want to get your name out there to start networking and start getting more ideas. So it's a really useful way of going forward. And it's something that I would recommend most people do early in their research careers. So I've got a couple of tips from others, and then we'll close for questions. So from the publication I shared with you quite early on, when it looks at what to include in abstracts, these are some of the things that they've identified. So simple language and phrases, no abbreviations. It should be informative, cohesive. They should ideally be structured. They should follow the target journal settings or subheadings as required. Make sure that if you had it on a separate piece of paper, everyone else could understand what you're trying to say, as opposed to just you trying to understand, because you know it better than anyone else. Try and be unbiased, honest, balanced, and precise, but also be confident. And don't mislead or misrepresent your data or the text. Make sure you use all of the word capacity as best as you can. So most of mine are 1 or 2 words short. They're never over, but 1 or 2 short max. And that's so that you can show the true facts of the data that you're trying to present, or the true messages that you're trying to push prominently. Try and avoid abbreviations as possible, and avoid a passive voice, and try and make sure your keywords are very, very relevant below the abstracts. So what I'm going to do now is I'm going to pause the recording or stop the recording, and we can then start taking questions. But if anyone is looking back at the recording and would like to get in touch or has questions on anything that's discussed, my email's on screen, so please do go ahead and send me an email.